Will it be on the same feed?
Hopefully.
Let me make sure we're going. Let me check.
YouTube should be okay.
Our
I think it looks like, hold on.
broadcast interrupted, but we're back because Gail just talked to me.
Back. We're back.
Are we here? Okay. So, and of course, Dr. Hood points out something really well as well. And
like
remember,
we're right back on.
if you're at a hospital with COVID, no family member will be allowed in, so you are isolated in a germy place alone. So
You're isolated in a germy place. Yes, and Dr. Clothier, being the doctor and the professional he is, uses the word germy. Or is that a Judge John Payton interpretation?
I'm going to say that's a Judge John Payton interpretation. I'm just saying. So when we go back to April, our deaths reached 2,700 on April the 14th, and then we dived down in June, 929 on June the 10th. Then we spiked to 2,400 on June 25th, and then we dropped dramatically, and then it's leveled out, and then we run anywhere between 1,900 to 1,700. And again, we're now at 220,000 deaths reported. You know, the accuracy of the reporting is coming truly into question at this point, and I question it. We've got people who are being reported to not even have COVID-19. And it's interesting because they did, but they're not getting reported in. I've got doctors telling patients, don't go get the test, you have it, just go home. And here's what you need to do.
Which is interesting because hasn't that been such a huge push because the government wants those numbers, and sometimes people were counted with COVID, so the numbers were skewed at some point.
Yes. And they're still
interesting.
skewed.
But then there's some people, I think, at this point. Now, I remember when we were exposed to it, my family, we went and we did, well, as an adult now, I had my son who's underage. I had to take him physically into a clinic. But as far as when I got tested, I sat in my car. I did not crack the window, did not open the door. The person was in basically a hazmat type style looking suit. So, interesting.
Yep.
Interesting. I think if you've got it, and take care of business.
Absolutely. And so when looking at the worldwide numbers, they claim that we're at 1.1 million, 27.5 million have recovered, and 40.1 million have actually had COVID-19 that they are aware of, right? So we're 1/5 of the world's deaths, supposedly. If you go to the same graph, it'll tell you state by state what everything looks like. And so in California, they've had 878,000 COVID-19 cases and 16,900 deaths. In Texas, 868,000 with 17,500 deaths. In Florida, they've had 755,000 cases with 15,000 deaths. And I wanted to get to this number. In New York, now you tell me how Governor Cuomo has handled this right. All right. This blows my mind. New York has had 489,000 cases and 32,000 deaths, 32,900, almost twice the number of deaths.
Well, and if you look at it, a large majority of those have come out of the New York City area. People live on top of each other. People were taking the subway. I think there's something to being able to spread out. For example, in Texas, our homes are not right on top of each other. We don't do a lot of public transportation. My husband went to get a haircut in the downtown or the Deep Ellum area the other day. Was like, I think I'm going to take the dark rail. Haven't done it in a while. We usually take that to the fair, but didn't go to the fair this year. Or didn't have the opportunity to go to the fair the normal way this year. And he said he got to the parking lot. It's kind of creepy. There were, he said, 5 or 6 cars in the entire DART parking lot, like early in the morning. And he's like, you know what? I think I'll drive. Said it was just kind of like a ghost town. So I think people are very concerned about that, being super close to people. And I think in New York, that was a big issue for them.
Well, but then the medical response, right?
Yeah.
And here the president rushes a medical ship out there.
Absolutely.
And all kinds of medical supplies. And yet their death rate is almost double what everybody else's is, but yet their infected rate is almost half of the big states. And so just very curious about when this is all said and done and the dust settles, because, Cuomo has taken quite a hit on how he handled the rest homes.
Right.
And nursing homes, and that he sent people back and they just died. And it's like, yeah, I mean, how poor of a response was the government in New York in assisting their own citizens? And then the way they treated other people that came into the state from the medical field to help out. And they're wanting to charge them state income tax on the money they made while they were there on location helping when they come back to their home states. Because we have a lot of Texas nurses and doctors that went out there.
Oh, absolutely.
And the state of New York is wanting to charge them income tax.
And to me, that's horrible. I even have a dear friend of mine, I'd mentioned her on the show, who used to be my dentist before she moved to the Pottsboro area. But she was also, before she became a dentist, she was an ER nurse. So she took advantage of what Governor Abbott put in place, which was to be able to reactivate your medical license, especially for nurses, because there was such a need. And I'm just sitting here thinking, so she shut down her practice, lost, income from being a dentist, went on her own personal dime over to take care of people in another state, which is a good and decent thing to do.
Right.
And then you're going to hit that person up with additional taxes?
Yeah.
Are you kidding me?
Oh, yeah. Coach Quigley piped on to the feed. He said, "Did you all see Sunday morning where singer Christopher Cross was a segment? He acquired the coronavirus, and then due to the virus, Guillain-Barré syndrome, paralysis.
Oh, Guillain-Barré, yeah.
And lost his voice.
Oh, dear God in heaven. Oh.
As a result
if you get caught between the moon and New York City, he's got an amazing voice.
Not anymore. Not anymore.
Oh, that's horrible. I have not heard of that as an offshoot of COVID at this point.
Well, and this is what we're going to be experiencing years down the road here, is what has happened to COVID patients after the fact medically. What tissue damage has been done?
Heart damage, liver damage, kidney damage. We don't know. I think you won't know. I mean, 10 years from now, we'll still be learning what has happened. Does it impact? It's, one of those things, if you had it when you were younger, which, a number of people in their 20s have gotten it and they bounce back fairly quickly. I know one friend of mine who's in her 20s, still, and goodness gracious, she had it back April, May. I mean, super early in, the grand scheme of things. And she's still said she's never felt 100% right. And she's somebody who jogs and hikes and does all these things. And she's just like, it's always like, I'm just kind of really tired and need extra coffee every day, and just doesn't feel like her body works the way it did before. And this is somebody who's in the height of their healthiness.
So here's something
so you
interesting.
Don't know.
And I heard this going on, and I had some doctors that I knew that came on and talked about this. Fred Nort on the crew said the plan Cuomo had backfired. A friend of his who works I remember Fred is from New York, was a peace officer there.
Oh, yeah. That's his stomping grounds.
Right. Who works at a hospital there, said they wanted any unknown deaths to be labeled as COVID. He supposedly did that to get more Fed money and try to make Trump look bad when he didn't give enough. And I had heard that over and over again. And he even gave the name. And so, and of course, then we've got other folks that have gotten the disease or the virus, and they have had no symptoms or they've had very mild symptoms for a day.
And they feel like they bounced back. Well, Gail said her daughter, her daughter's boyfriend and roommates, and his roommates all had it. No problems.
Right.
So
bottom line is that this thing's a virus. It's not going away. It's going to stick around, and we just have to learn to work with it. And it's like the flu. I had the flu, I think, twice in my life. Once as a child, and then when I was in my early 40s. And fortunately, I went in and got the flu shot, so it reduced the amount of symptoms I had, and it shortened my illness.
Right.
So I don't want to catch the virus. I don't want to catch the flu virus. I don't want to catch the Ezekiel Elliott virus, because I don't know how to say it, Zeke or whatever. I don't want to catch West Nile virus.
Don't want H1N1. Don't want Ebola.
Don't
You
want
don't want any of those, and especially when you get older, and if you've got issues yourself. I mean, obviously, we've talked about it many a times on the show. I've got scar tissue on my lungs from chronic bronchitis, and so the fear of getting something, that's real, because then I'm like, okay, am I the person where my lungs are already compromised? Or like your situation with taking care of your dad, who is, and we still want prayers. Now he's cutting up and driving people crazy, so we think Stan's pretty much back to normal, but he's still in the hospital. There's still some unanswered questions, and
he had a stroke. He
did, and so we want to make sure that everybody in the crew is continuing to pray for Stan Payton.
Thank you.
JP's dad. You want, and I think that's where at the end of the day, and I hate that they've politicized. I hate that this has been politicized. Like, if you want to wear a mask, you're this, and if you don't wear a mask, you're this, and if you're this, that. You know what? We're all individuals. We all have our own opinion, and thank God we live in the greatest country on God's green earth, and we should be able to have our own opinion without being shamed in one shape or form.
Right.
But at the end of the day, I think everybody wants to take. I know there's some people out there, and maybe they're younger. They're like, oh, I don't care. I'm fine. I'm not going to get it, whatever. I don't think any of us are not taking it seriously,
Well, I'll be honest with you. I have seen some people with a cavalier attitude about it. They're like, well, I'm in good shape, and so I'm not wearing a mask. I don't need to wear a mask.
Yeah, but then they'll be the same person you'll see out, and they're not amongst their peer group, and they will be wearing a mask. So.
Well, I'm going to take this moment.
But we've just got to be smart about it and take care of yourself, take care of each other, take care of your loved ones.
We do. Oh, I agree. Yeah. I agree. Let's get Chris Getz on with Acadia Healthcare. We're going to have her move over this direction to this chair over here.
It's been too long, Chris.
While she's getting
headset for you.
While she's getting set, Kathy and I will be hosting a debate on Tuesday. This Tuesday. We want you to come out and join us. And Chad Green's already reached out to me. Kathy, you and I have got to look over the questions, because we here at JP, Kathy, and the crew will be moderating.
We are very excited. Hashtag no Chris Wallace moments.
Right. No Chris Wallace moments. At the end of the show.
I'm the parent. I mean, the moderator.
We're real excited. This is the Shelley Luther Drew Springer runoff, which has drawn
state senate race.
Yes, state senate race SD 12 has drawn national attention. So we're very honored that we were asked to moderate this so important debate. The runoff is, of course, on December 12th. I need to look that up.
I believe that was correct.
Somewhere around there. So,
but and we were going to have Chad Green on and to talk about it, but didn't get around to getting him onto the station on the show before the debate tomorrow night.
Yep.
But at the end of the show, we will put up some information.
Perfect.
We would love for you to come out and join us for the debate, but you can also catch it on JP, Kathy, and the crew live.
Yeah. So, do we have permission to run it live through our broadcasting system? I'm assuming they'll be cool with that.
Who?
The group who's putting on the debate.
Oh, I didn't ask.
I'm sure they'll be.
I didn't ask.
Oh, we were just going to hook up the broadcasting system, but okay.
That's what I'm doing.
Chad, folks, is that cool?
Yeah.
I'm assuming it's okay, because other people will be doing live from their phones.
I'm just
stuff.
doing it. I'm not asking.
Ask.
That's their fee.
What is that? Ask forgiveness, not permission.
Yes, that's their fee. So towards the end of the broadcast, I will look it up and get that information over to Charles and have him throw it on the screen. In the meantime, I am excited to welcome to the show, and we're going to continue to get her ready here on her microphone. But one of the people that has really seen the importance of publicizing, talking about, not hiding behind a screen, mental health. Patty and Steve, and I don't remember if you remember Patty or Steve, are not from the Mental Health Moment, but they are back, and today is our kickoff day for the Mental Health Moment. Of course, Patty is with the Something for Kelly Foundation, and Steve Dunn is with the Morgan Foundation, and so as well as I am. And they went to Chris. We met and we had lunch, and Chris and her organization, Acadia Healthcare, thought it was important that we put something out there like this, and that we start start providing education and resources
Yes.
for people.
Oh,
and
yes.
Chris Gatz, thank you so much for joining us
It's
this
so
morning.
good to see you again.
Good to
It's
see
been
you
too
too.
long.
I know. I'm jacked up on coffee. I've got the wind in my sails, and I'm raring to go.
So
We've missed your beautiful face. So we're glad
Kathy's
you're back
jacked up
here.
on drugs.
Yeah,
You're jacked up on
I'm
coffee.
jacked up on the breathing machine,
Again,
breathing medicine.
if you'll just leave your outline, I'm gonna go ahead and head on out and get some breakfast because the
He's
two
like,
of you.
wait. He's like these two blondes. One's jacked up on asthma medication, her albuterol. One's jacked up on coffee. He's like, I
don't
am
have a
in for a
chance.
dangerous ride.
I don't have a chance. I might as
Somebody,
well.
he's like, help me.
Right. There's
He's
no,
doing Morse code.
I get no words in on this deal, that's for sure. So with that being said, though, so Chris, first of all, thank you again for you and Acadia Healthcare for seeing the importance of not allowing mental health to become taboo or stay taboo, not
Right.
become, stay taboo and make it mainstream. God bless you and your company for doing that. Thank you for sponsoring
It's a
the
pleasure
mental health
and a
moment.
privilege. Yeah, it's a pleasure and a privilege.
So talk to us about Acadia Health. Just give us a quick summary. What is Acadia Health about and how can they help people?
Well, we are the largest provider of behavioral health in the world. We have 584 facilities and possibly counting for all I know.
Right?
And I love this company because there's so many resources at our disposal. So about 5-6 years or more ago, they started this initiative with, treatment placement
Right.
specialists so as to provide this concierge service for persons that are maybe needing a higher level of care, residential, hospitalization, IOPs, PHPs. So
And IOP is is that the in-house?
intensive outpatient.
Okay, so you live at
Yeah.
home, but you come back.
Yeah.
Okay, and then what's the other one?
Partial hospitalization,
Okay.
or PHP, is where you're there for about 6 hours a day.
Okay.
Several
Getting
days
treatment, then you
yeah,
go-
but you
okay,
still go
gotcha,
home. And then
gotcha.
residential is when you're actually in a facility for anywhere from 21 to 90 days, depending on the facility. Some facilities may keep you for 6 months.
Wow, okay.
So, and then that's where you're actually staying there at the facility. So we have a child and adolescent division. We have an eating disorder division. We have adult residential. We have strategic account managers. Which this is what I really love about working with Acadia. I can partner with our strategic account managers, which are folks that have been assigned to specific people groups. For example, we have a veteran division and a specialist to serve veterans. We have a couple of former chiefs of police that are assisting with first responders. We also have, I just got off the phone with our psychiatric nurse who works with all of the professionals programs, and we make sure that we get them in a professionals track. So there's a lot of we can provide quite a concierge service. And here locally, I'm just a resource. I'm a resource, and I can help with persons that are, whether it's beginning, prior to getting some sort of resource,
Right.
or while they're at the facility, and even after they've come out of the facility. I'm here to provide all of those wraparound supports and act as the concierge while they're in treatment and work with them and their families.
So very quickly, how do they get a hold of you directly? Because you will help them in this area. If somebody is watching this show and they need help, they do not have to be public. They do not have to expose themselves. They can make a one-on-one private phone call to Chris Getz.
Absolutely.
How do they get a hold of you?
Well, there's 2 telephone numbers, 469-400-7499. That's the BAT phone. But my personal phone has also been used as a work phone as well. So 817-307-4538.
Okay.
All right, very
And
good.
we want to make sure we get those from you afterwards to put them in our feed for this Facebook Live feed so people have access. And we've talked about this before with mental health, and it's just so important. There's a friendly voice on the other end of a phone call. And even if you feel like you're overreacting, better to act and be safe rather than be sorry. Better to have your family member, your friend, your spouse, your partner, whoever it is, upset with you because you thought, you know what, I need to take serious action.
Right.
But at least they're still with us.
Right, right. And I am a licensed therapist too. So sometimes people just need someone to talk. They need to just be
Absolutely.
able to
Absolutely.
process. And so just having that voice on the other end of the phone that can just listen and provide ideas and resources can be very helpful.
How important is it today for organizations like yours to be socially responsible and do things like this, sponsoring the mental health moment? How important is that, especially during COVID-19 times?
I think it takes the stigma out of, any mental health concerns. I think we are, all of us will struggle with something at some point of our lives just because of the world that we live in. I mean, you may, death of a loved one or
Divorce.
Yeah. We all struggle with something.
Loss of a career, all kinds of stuff.
Right, right. I mean, one of the funny things I remember just from grad school was evidently when we were all, going through the DSM, we evidently were going up to the professor and saying, I've got this, I've got this, I've got this. And he finally just stopped the class and said, look, we're all going to struggle with these things from time to time because we're human. The difference is how many symptoms you have and for how long. So,
yep, that's a good point.
So going one step further is important during these times for a company like Acadia Healthcare, because they don't have to do any of this. They don't have to sponsor the mental health moment, but yet they choose to do so. And I think it also helps build confidence in people as well to know that you're out there doing something locally to help support the local community. So our hats off to Acadia Healthcare for finding the importance of that, and we appreciate them for that.
You're most welcome.
As well. And so just kind of a finishing question, right? COVID-19, because it's a big one.
Yeah.
It's been huge. Suicide numbers are up amongst teens. Alcoholism is up amongst adults and teens.
Drug use.
General substance abuse
yeah.
is up amongst adults and teens. Spousal abuse, child abuse, depression, anxiety, eating disorders. I mean, we have all kinds of craziness going on with food and eating because everybody's stuck at home, right? And some have lost weight and some have put weight on. And so how has Acadia responded to that, and how have they been able to help in this COVID environment?
Well, you mentioned adolescents, so I've seen a huge surge in adolescents needing residential treatment. And so I know some of my facilities have opened up second units so that they can, keep them more socially distanced. A lot of our facilities are, because they're so overwhelmed with admissions, opening up, when they do have space, or shifting things around so that they have more space. We're doing a lot of things virtually due to COVID. We're doing a lot of testing, asking for tests prior to admissions.
Okay.
And then limiting, the amount of people that are coming in. So a lot of our facilities are taking precautions all over the nation. Kind of depends on where. Some of our facilities maybe are in a location where COVID is not quite as bad as it may be, say, in California.
Right.
So, they may see people still face to face, but they're socially distancing.
Okay.
So Acadia Health, have you guys had a run with COVID in the facilities?
We haven't had anything that is, we've had more trouble with the fires in California than anything else.
Wow. Okay.
We've had to move people and
I didn't even think about that. Yeah. Well, y'all have adapted. I mean, you've got a very professional organization. You've got within y'all's group, and including yourself, Chris, y'all have got forward-thinking people who think out of the box, because you're always trying to, how do I put that client first? How do I get that person from this point of despair to, productive member of society again? So you guys, I think y'all naturally think like that. So maybe something like COVID, obviously you've got to put certain things in place, but you guys are already thinking 10 steps down the road as far as how to help your patients.
Yeah, they were on that from the get-go, just all the way to the top, talking about what do we need to look for, what can we do, how can we help support.
Yeah, God
and
bless y'all.
alleviate concerns when
God
people
bless
are
y'all.
traveling
Sure.
across the state lines.
Absolutely. Well, I cannot thank you enough, Chris Getz and Acadia Healthcare, for being a sponsor again with the Mental Health Moment. We will not let you down.
Kicking off the mental health moment
That's
with
right.
us. This is
Right.
awesome.
So very exciting.
We will not let you down. I promise you. Our first guest today on the Mental Health Moment is an amazing woman who's doing amazing work.
Yes.
Out of the University of North Carolina, brought to us by Patty and Steve. Really, the Something for Kelly Foundation doing an amazing
Yep.
job, and
Yeah.
the Morgan Foundation help making that happen. And so we're going to be excited here at 8:30
Yes.
to get that rolling. And so, just one last comment. From a fashion standpoint, love the necklace.
I know. She always looks great. She's always
Right?
accessorized.
Love
She always
the
has
necklace.
great shoes or boots on. I love seeing Chris during the winter. Side note, nothing to do with mental health, but she always has cool shoes or like some
Right.
kind of cool boots on or something. Yeah,
Absolutely.
good point. I was all over the
Yeah,
necklace
the
too.
necklace is very good. Hopefully, she got it from Patty because Patty does jewelry.
I get a lot from Patty.
So hopefully she got it from Patty.
Yeah.
Well, Chris, thank you so much for joining us, and don't leave the studio because we've got the Mental Health Moment coming right on with Acadia
I know.
Healthcare.
And just so you'll know, in the future, we hope to be part of the genetic testing initiative.
Oh, very nice.
Oh,
And she's opened up the can.
fantastic.
She's opened up the
there we
can of
go.
Chris,
worms.
you've done this before. What a great
Introduction.
transition.
Yes, there we go.
She gave us our transitional line from one guest to the next.
All right, so
thanks,
as
Chris.
we,
We love you. We really appreciate you.
Appreciate
Thank
you. So as we shift, we're going to talk a little bit about November the 11th.
she gave us our own.
She did.
We didn't even have to have a transitional line.
We
Chris
don't.
gave it to us.
She did. Charles, you should have Dr. Cyndi Bulick coming into the waiting room, if not already there.
Cindy's in the waiting room.
Okay.
Yay,
She used the
good.
Zoom link, right? Not the Google Meet link, right?
I don't know, but I did get a text. She's
Okay,
in,
Chuck
she's in the
says
waiting
she's
room.
there. While we're getting everybody settled, though, I want to talk about November 11th, Veterans Day. Here at JP, Kathy, and the Crew Network, the network will be hosting a telethon from 7:30 to 5:30 on Veterans Day as
Yes.
we kick off the a
Big day
new
of fun.
disabled
Yeah,
show,
we've
a
got
new
a-
disabled veterans. Why do I do that to
new
myself?
veteran show,
A new military veteran show.
and we've got a great new program coming up. Of course, we've got Kilroy's Conversation, and they've got a certain format that they talk about. This is going to be specifically about how do you go from military life to civilian life in a successful manner. Even if you're in civilian life and you have been for years, there may be things that are there for you that you don't know about. Of course, the Disabled Americans veterans, gosh, now you've got me making
Right.
up words. They're going to be hosting this.
Well, they're
this talk show.
sponsoring it.
Sponsoring this new talk show that we have. We kick it off on Veterans Day. We're going to have a blast up here. There's going to be
Yep.
breakfast, lunch, happy hour. There's going to be paper football league games going on. Several people from our different podcasts are going to be coming up here and doing a portion of the show and talking about what they do. I think Gail and Steve Meeks are going to be up here with some financial
Michelle from
stuff.
the Crew is going to be up here, I know for a fact.
Perfect.
But
Good stuff.
Anytime during the day, and what we want you to do is bring your phone, and you're going to just call your contacts.
Yeah.
$1 is better than no dollars at all. All that we raise that day will go to Disabled American Veterans.
Yes.
97 cents on the dollar goes to the veteran.
Which is amazing. So your donation is
Fred
is
just confirmed
guaranteed.
he will be here on that day as
Fred,
well.
Yay. Okay, so and we'll have members of the crew like Fred if they want to pop in on the microphone and
absolutely.
take a 15-30 minute segment, they can come on in. So
And talk about it and make phone calls.
Yeah, a number of the folks who work here in office out of the Venture X building, which is just such a great environment to be around, such a positive place, especially during COVID, and we're talking about people having trouble working from home. Come up here for a very affordable price and be around other people at a safe social distance and take care of your mental health by working out of Venture X.
Right, not having the kids grab a hold of your shirt tail. Speaking of shirt tails, I'm going to ride the coattails of the most amazing doctor in the country as far as I'm concerned.
She's incredible.
Dr.
She's
Cynthia
incredible.
Bulick. Good morning, Dr. Bulick, and thank you for joining us again.
Morning. It's great to be back, everybody.
Amazing work that you're doing. I am so pleased that you are the first guest as we launch you on our network with the Mental Health Moment. We've created our own network, Dr. Bulick. We're out of control.
And that way we can bring you in on a big screen TV. Oh, she's all raised the roof.
Yeah.
Okay, so she's brilliant and hip.
And very much so. And we cannot thank enough, and we've got Steve Dunn that's going to join us here from the Morgan Foundation. Cannot thank enough Patty Gillette. I love saying her name.
You usually say it
I say it wrong. I normally say it
usually
wrong. I probably said it wrong again.
Dr. B says, how do you pronounce your name? Because the only person I've ever heard say it is the judge. And I don't know if he's saying it correctly.
He's saying it in a super fancy way.
So we've got the Something for Kelly Foundation in studio, and cannot thank Patty enough for bringing Dr. Bulick to JP Kathy and the Crew Network. Steve Dunn is somewhere out there. We're going to bring him out of the internet world. But my understanding is, Dr. Bulick, you are doing amazing things, and I'm going to turn it over to Patty and let her dissect what you're doing, because I am so very excited to hear all of the news. And just, again, I'm just thrilled that you're here with us, and I've missed you and glad that you're here with us. So thank you, Dr. Bulick.
You betcha. Always happy to be on.
Good morning, Dr. Bulick. Once again, welcome, and thank you for joining us. John and Kathy, if you only knew how busy this woman is, virtually, right? I mean, she's in Spain, she's in Asia, she's in the Middle East, she's in the World Congress of Genetics, psychiatric world. I mean, she's...
Her resume is when we say world famous, we're not just being our goofy selves.
No,
this is truly. I mean, we are with a person in the mental health field who literally is a hero to people worldwide. She is.
Absolutely. John, I just got a note that Steve's in the waiting room.
Yeah, Chuck knows. Chuck's working on it.
Okay, we're good. So, actually, Kathy, this is more true than some people really even understand. Dr. Bulick and I became acquaintances at first, and then we became friends, right? And then I started doing some real homework about how important she is and how much she has done. And I am so grateful that I did not know any of this until very recently, because quite truthfully, I would have been intimidated. So she graduates high school early, she graduates college early, she's in the top of her class, she's a world-class figure skater. I mean,
that's so cool.
You name it, this woman can do it. And oh, by the way, she's a geneticist. So okay,
that?
Dr. B, we are so grateful to have you with us. But there's Stephen Dunn.
We have Dr. Steve as well. Of course, his is a JD. Not nearly as impressive as Dr. Bulick. No offense, Stephen.
We love you, Steve, but
Absolutely. And what Patty did not say is one of the great things about Dr. Bulick, of course, is she's one of these really intelligent nerds. She's got this nerd quality about her that's just so compelling.
She's like, I didn't know this was a roast. This is your life, Dr. Bulick.
But she owns it beautifully. So there you go.
Absolutely.
All right. So we got to get out of the way. I want the information
mental
out.
health moment.
I want to start
Take
peeling
it
the
away.
onion. I want to hear what she's been doing. Let's get to her.
Let's get to her. So Dr. Bulick and I met each other, 18 months, 2 years ago, something in that flavor. And I invited her to come to the Something for Kelly annual event last year. And she's talked about her most amazing research initiative on anorexia. And she learned so much about the metabolic connection. And then I learned that she has this additional opportunity for research. And I'm going to kick it off and ask you, Dr. B, to talk about the newest initiative that you launched last week, which Something for Kelly is doing a major support for.
Sure. And again, thank you for having me back and for talking about EDGI, which is our new initiative, and it stands for the Eating Disorders Genetics Initiative. And that follows on the heels of the study that Patty was talking about, which was ANGI, which was the Anorexia Nervosa Genetics Initiative. But the reason the name has changed is we have expanded, and we're not just looking at anorexia nervosa now, we're also looking at genetic factors that influence risk for bulimia nervosa and binge eating disorder. So the three main eating disorders.
So Dr. Bulick, would you talk a little bit more about what you anticipate these results will be able to help you to do? Treatment, identification, diagnosis, take it and really give us some in-depth information.
Sure. Well, I think I'll sort of rewind and say what the Angie results let us to be able to do, and then I'll move into EDGI. So Angie has basically led to a whole reconceptualization of what the causes of anorexia are. So originally, we thought it was just a psychiatric disorder, and our results not only identified areas on the genome that influence risk for anorexia, but we also unearthed what you just mentioned, Patty, is that there are not only psychiatric origins, but there are also metabolic origins to anorexia nervosa. So this opens up a whole new pathway of understanding and potentially also of pharmacogenetics, or using genetics to help us develop new medications that actually target the biology of the illness. And the goal, of course, is to be able to do the same thing for bulimia nervosa and binge eating disorder.
So I found out something that I found to be very interesting, in that everybody hears the word genetics. So there's the Anorexia Genetics Initiative, and then there's the Eating Disorders Genetics Initiative. So there's a lot of focus on genetics, but your research is really more than genetics. Would you talk a little bit about the research that you want to do, or that you're doing, not that you want to do, and the survey that people would take? Because we want to direct our viewers to this research. So talk a little bit about nature versus nurture, and talk about how they can participate.
Sure. So the best way to participate is to go up to www.edgi.org. And the bottom line, Patty, is I am moving people away from nature versus nurture to really embrace nature and nurture, because it really is about how they act independently and co-act, how nature and nurture interact with each other. And what we're doing this time in EDGI, more than we did in Angie, is we're gathering a whole bunch of information from people. So not just about their eating disorder, but also about other experiences they've had and other feelings they've had. So self-report information online about depression, about anxiety, about life events that they might have encountered, and about substance use as well. And up until now, we really haven't been able to harness the environmental factors that influence risk for eating disorders. And we think the way to do that is actually via genetics. Because basically, we're all exposed to these cultural messages about thinness and dieting, but we don't all develop eating disorders. So if we can figure out what genetic factors make some people more vulnerable to those illnesses, that's going to be a good outcome of this research.
So I didn't quite...
Doctor, one of the things we hear about research studies in the past is there's been some questions raised that they're skewed, that they only involve the Anglo community. What is being done to be more inclusive of minorities, BIPOC, LGBTQ, those people who have been or claim to be excluded from past studies?
So a couple things, Steve. So one of the things that we've done is we've made sure that we've profiled people from all sorts of backgrounds as examples of people who participate in EDGI. So we had a big media launch last week, and we had, I think, 20 or 30 people who we profiled from all sorts of different backgrounds. Even different languages. So we had Spanish-speaking people, we had traditional Mandarin-speaking people, we had people of all shapes and sizes and colors. And part of what we're actually doing is specifically inviting people from broad backgrounds to participate, because you know as well as I do that eating disorders don't discriminate. And part of it is really figuring out how best to reach those people and encourage them and to get them to trust us to participate in the research. And in fact, we're going to be launching EDGI Español in a couple weeks. We're actually working so that we're going to have all of our questionnaires in Spanish, so people who feel more comfortable participating in Spanish will be able to.
Doctor, you mentioned this real briefly there. Get them to trust us. What do you mean by that? Has there been a bias that has, or perceived bias that has prevented the marginalized communities from participating before?
And I think that is one of the beauties of having this being a completely online study. I mean, all people have to do is fill out a questionnaire, and we send them a little saliva tube that they spit into and send it back. And one of the things that we found in North Carolina, which has a very big Latino population, is that, coming to the big place on the hill, especially if you're undocumented, can be intimidating, and it can be something that people don't want to do. And so that's why I think making it so easy, something that someone can do from, once they get online anywhere, really increases the likelihood that people will feel comfortable participating.
Dr. B, speaking of diversity and people not feeling comfortable, I'm just going to put it out there, and I'm sorry if this is sensitive, but a lot of us know that the Black community does not feel safe with research, medicine, doctors, and we have talked about how do we get people, not just the Hispanic community, but people of color who are very concerned about sharing their genetics, doing a saliva test. We've had some pushback and some resistance. And so I know this is not an easy conversation, but we don't care whether it's easy, do we, John?
Well, that's the point, though, of us doing this, right? And Acadia Health supporting and sponsoring all of this is that we don't want it to be taboo. We don't want it to be behind the curtain anymore. It has to be in the forefront. Society has to learn that this is a part of what we need to be doing. And so that's what Dr. Bulick is doing. So
part of what Something for Kelly is doing is helping to diversify this population. So Dr. Bulick, help us understand how we can reach out to those communities, not just the Hispanic and the other languages, but the people who are afraid and concerned about doing this test.
Actually, I'm going to volunteer one of my colleagues to come on your show. I've been working with Dr. Rachel Good, who's a doctor of social work here at UNC, and she has done amazing work adapting cognitive behavioral therapy for binge eating disorder in the African American population. And her work is brilliant because, instead of saying that cognitive behavioral therapy is one size fits all, she is perfectly clear that we need to make certain adaptations to make it comfortable for the community, not only what the content of the therapy is, but where it's delivered. And again, she's looking at community, places where you can identify people who are interested in participating, going so far as to going to local churches and local hair salons where people gather and saying, this is me. I have been through this. I am part of your community. And we want to hear from you the proper way to adapt our treatment to make it comfortable for you. Instead of, someone like me saying, well, I think this would be a good idea to do. She is in there working with her community, figuring out how best to bring treatment to people where they go for it and where they're comfortable with it.
That is an excellent point, Dr. Bulick. John, were you saying something?
Well, I'm going to tell you something. I can't wait to get that person on, Dr. Bulick, and here is why. Demographics are not necessarily even culture or race-based. It could even be regionally based. For example, this is and I'm taking us into food, interestingly enough, but, for me, chili doesn't have beans. But in Michigan, chili, beans are automatic. To me, that's chili beans. Culturally, it's just chili. Chili is no beans, and so
them are fighting words.
They are.
Okay, tune in Friday for chili beans or no beans throwdown. Just saying.
Coming into chili season,
it is.
Okay, but we digress.
Well, but my point is that the mindset of our community then becomes even more micro within that community, which could even go even more micro into that culture or race base into that community. And so I can't wait to have her on. And can we peel the onion back far enough? Is there enough money in the research? Do we have enough people? Can we pull enough interns to go out and do a viable job in pulling that data? I can't wait to talk to her. Thank you, Dr. Bulick.
We will definitely have
I
your
think
colleague
one
on.
thing I will add to that is actually the pipeline has to start early. We don't have enough diversity in people who do research in eating disorders. So we need to start identifying people as early as high school, to start doing internships with us and summer internships with us so that we can sort of cultivate their careers all the way through college, graduate school, med school, whatever, and make sure that pipeline doesn't leak along the way as well.
That's an
Doctor, so how do you make to the average high school kid that you want to bring in as an intern. They're going to hear eating disorders and mental health, and most of them are going to say, peace out. What can be done to make them understand that this is a serious, compelling topic, and if they immerse themselves, great things can occur?
I think we're getting there. We had a couple high school interns just this last summer that we had to do virtually, of course. But we have reached out to the North Carolina Science and Math High School. We've had interns every summer working with us. And I think part of it is also making sure that we appeal to people who love biology. Because, if we're just talking about psychology, you don't necessarily get the people who want to do the hard genetic research or really get to the underlying biology of these illnesses. So once we start debunking these myths that eating disorders are a choice and somehow just culturally caused, and help people understand, you can do brain research and you can do genetic research. And I mean, eating is pretty biological. So, once we get people to realize that that's all connected, we get some pretty darn interesting kids interested in doing research with us.
Quick question from the crew, Dr. Bulick, and I think it's a good question, and it goes back to your nature versus nurture, or nature and nurture. With this genetic testing, will we be able to know if these disorders are from nature or nurture?
So again, we are gonna know, and we already know that it is both. It's never going to be just one gene. So we've identified 8 regions on the genome for anorexia. We anticipate that there will be hundreds. And that's really where we're going. So what happens is once our sample size gets large enough and we have enough people participating and enough DNA from enough people, these genes start to assort into pathways. And then those are the biological pathways that have gone awry. And might contribute to risk for eating disorders. Now, you can have high genetic risk for an eating disorder, but never necessarily express that genetic risk. If, for example, you never go on your first diet, the diet might be the trigger. And that might come from an episode of bullying. So right then and there, you have nature and nurture working together to cause an eating disorder. And that's what we're going to be able to figure out.
How is that going to inform you about diagnosis and treatment and saving lives? Because at the end of the day, that's really what the Mental Health Moment and Something for Kelly and the Morgan Foundation are about. We are about saving lives. And I know you are too also, Cyndi. So I'm not saying anything that you don't already believe in.
No, that's absolutely my passion. And I will say one thing sort of to the side, as I think things have gotten worse since the pandemic started. I have been contacted by more people who have lost their children from anorexia since this pandemic started than I have ever in my entire career.
I'm sorry.
So I think when we look back, we're going to see an uptick in deaths from this illness. But back to the question. So right now, when someone walks into my office for the very first time, I don't look at their genes. I look at their family history. I look at, the course of their illness, but I have no way, Patty, of predicting who is going to get well after a year and a half and who is going to go on to develop a severe and enduring course of the illness. And part of what we're hoping is that the genetic work that we're doing is going to help us be able to identify maybe what subtype of an eating disorder they have. Maybe they'll have a more metabolic type of anorexia rather than a more psychiatric type of anorexia. And that could direct how we go about treating them. Because right now, it's one size fits all. We expect everybody to respond to the same treatment. And as you know, we have no FDA-approved medications for the treatment of anorexia, and only one for bulimia and only one for binge eating disorder. And bulimia that's been approved for like over 20 years. And then people just sort of walked away and said, one's fine. Imagine if they did that for high blood pressure. It's like, imagine if we only had one medication for high blood pressure in our armamentarium. I mean, most of us would be dead from strokes at this point. So we have to broaden the clinician's toolbox for all 3 of these eating disorders.
Okay, guys, I've got to run off the court, but before I do, just have one last question here. We've got thousands of kids going into these residential treatment programs every year. What do we need to do to bring the residential treatment programs in and have, when kids are being admitted, it's mandatory that they do the EDGI survey?
Well, we can't make research mandatory because it's always a voluntary enterprise and you always have to fill out informed consent. But we sure would love to get all those residential programs on board and letting their patients know that this study exists. Because in the long run, we can help them. We can help them do better. We can help them design evidence-based treatments that actually direct the underlying causes of people's illnesses. And bottom line is, we all want people to get better. And that really is why we're all in this field.
Dr. Thanks. I am out, guys. Can't wait to be back on with you next week. Dr. B, thank you, of course, for all you do.
Take care, Steve.
All right. Thank you,
Bye,
Steve Dunn. Also want to take this moment to identify our sponsor for the Mental Health Moment today, Acadia Healthcare. Visit them at acadiahealthcare.com. Contact your concierge. That's right, Chris Getz. Contact her at 469-400-74. And, of course, my eyes are horrible. 7499. Again, that phone number, 469-400-7499, and cannot thank Acadia Healthcare.
And we'll put that information.
We will.
Yeah, in our feed
for bringing the mental health moment here to the JP Kathy and the Crew Network, where we can get great people like Dr. Cyndi Bulick on from the University of North Carolina. So, Patty, back to you.
Doctor, you mentioned something just a minute ago, and I don't know if everybody understands that. You mentioned something about a subtype. Would you talk a little bit about that? Because I think that the people know generally, who are viewing us, know generally about eating disorders and obviously mental health in the big picture, but talk a little bit about the subtype that you were referencing.
Sure. So right now, just in terms of the diagnostic categories, we know that there are two subtypes of anorexia nervosa. One is the restricting subtype, where people just don't eat and increase their physical activity. One is the binge purge subtype, where people have anorexia, but they also binge eat and they might engage in other compensatory behaviors like vomiting or laxative use. But that's not what I was talking about. What I'm talking about is whether we can actually use genetics to identify different types of anorexia nervosa or different types of bulimia nervosa. And we're seeing this with cancer. I think that is the best example. They're now able to genotype cancers and make decisions about what medications will be best to ameliorate that particular type of cancer based on its genotype. We hope, be able to go down the same path with eating disorders. And for example, say, this person's anorexia really is heavy on that genetic metabolic component, more so than the psychiatric component. So we need to treat it more as a metabolic illness than as a psychiatric illness, or vice versa. So that is the fantasy and the hope for where we'd be going with this kind of work.
We have another question from, and we're going to come back to that, Dr. Bulick. We have a question from the crew again. This is from Marvin up in Oklahoma. Do they do a MMPI test?
So the MMPI is the Minnesota Multiphasic Personality Inventory, which is a whole bunch of questions that gives you sort of a personality readout of what you're like. And Marvin, I'm sorry, we do not do the MMPI because we really are focusing more on depression, anxiety, substance use, and life events. And the MMPI takes a really long time to do. So we want to make sure we don't overburden our participants.
Thank you for the question, Marvin in Oklahoma. All right, go ahead,
So
Patty.
speaking of that survey, Dr. Bulick, how long does it take? Talk a little bit about what happens if they go to edgi.org. How about that for a little commercial for you? What are they going to experience, Doctor?
So if you go to edgi.org, first you'll get a questionnaire that asks you a lot of questions about your eating disorders history. And I want people to know in advance that we do ask questions about their weight. We do ask questions about their eating behavior. So if that's something that's really sensitive to you, you might want to make sure you have someone that you can sort of debrief with after you do that. Because I know talking about weight is really hard for people with eating disorders. But at the same time, in order for us to do this research, we have to understand and we have to know what your weight history is like. And then after you do that, we're looking for people who have anorexia, bulimia, binge eating disorder. You get mailed a little saliva kit that you spit into And all you do is spit into it, seal it back up, and send it back in the post. And you also have a bunch of other questionnaires that can take anywhere from an hour to an hour and a half, depending on how slow you are, how fast you are, and how many things you have experienced.
So you mentioned earlier also that with the Anorexia Genetics Initiative, there wasn't as much of a survey about behavior. What are you trying to get to? What's the history of that? What do you hope to accomplish? How's that going to impact treatment? Is it going to impact diagnosis?
All of the above. So we are part of the Psychiatric Genomics Consortium. So, we're the eating disorders group, but there's also depression, schizophrenia, anxiety disorders groups. And we're sort of leading the way in terms of what we call broad phenotyping. And that means that we're getting information about all of these different areas. So not only will we be able to look at the genetics of eating disorders, but we will be able to look at the extent to which we share genetics with anxiety, with depression. So we're really creating a whole palette of genetic understanding that helps us understand the full person, not just their eating disorder.
I'm a little bit stunned on this one, John. I mean, Cyndi, I know this is groundbreaking. I mean, I know the size of the study is groundbreaking. I know that it's not just genetics. I know that talk about what the groundbreaking aspect is going to be that you hope to accomplish. And really, this is your last couple minutes to encourage the group of people listening to you to either sign on to this study if it impacts them, or to share this concept and opportunity with their family and friends.
Bottom line is, Patty, we need 100,000 people to participate in this study, to really get enough DNA to get the answers that we want. And just because we're out there doing the study doesn't mean that people are signing up. So we really do need people to go out there and scout for us and encourage people to participate, because the people who participate are as important to the research as us scientists are. We're a team, and we all have to work together in order to advance the science of eating disorders and ultimately to stop deaths and improve treatment.
And one more time, let's talk a minute about diversification. This is an international study. This is not, I'm going to say this and it might not be politically correct. This is not a North American, affluent, sorority, white girl problem. Cyndi, please talk for a minute about how wide-reaching and how worldwide this problem is.
Right. I mean, so right now we have New Zealand, Australia, Denmark, Sweden, the United States on board, and the UK on board. We're bringing Mexico on board, Puerto Rico on board, the Netherlands, Germany, and we're trying to reach out to Taiwan as well. So these disorders afflict people around the world. And part of what we need to do is we need to figure out if the same genes are actually operating across different cultures and across different populations. In order to do that, we need participants. So that is the plea for people. If you've had an eating disorder at any time in your life, because your genes don't change, you are welcome to participate and would love to have you on board.
Would you talk for a minute about confidentiality? I have had some people issue a concern about, I don't want to share my genetics. I am worried about what's going to happen to that. Would you talk about how secure this research is going to be?
Right. So once we start doing the analysis, once we get your saliva and extract your DNA, we don't know whose DNA that is. So that's why we can't give you specific information back about your genetic testing. This isn't like Ancestry.com or 23andMe where you get a report of things like that. This goes into a big group. We connect it with the information from online, but we don't have it connected to your identification. So that is, we have all sorts of ethical permissions. And in Europe, we also have something called GDPR, which is an even more stringent security and privacy law. So we are maxed out in terms of privacy and confidentiality.
Well, and I was going to say this as well. You know, our sponsor, Acadia Healthcare, wants to be a partner with a partnership, I think, with UNC and your research, your genetic research, Dr. Bulick. So I think you may be getting a phone call.
I was going to say, call me.
Chris Getz has a big old smile on her face in the back of the studio. So, I think there's going to be some contact
There's
there.
going to be a partnership brewing up there.
Absolutely.
Love it.
And I'm going to be contacting you, Dr. Bulick, because I've got an idea of a way that JP, Kathy, and the crew can create an internship program here in Dallas to support the research that you're doing and be able to get out amongst the Dallas area. So we'll talk about that. I will contact you and we'll talk about that.
Y'all are wonderful. Thank you so much for having me on again today.
Oh, goodness gracious.
We could not have had a better kickoff to our new and improved mental health moment on JP, Kathy, and the crew. We are so grateful and so blessed just to know of a person like you, but to actually have contact and interaction and bring this knowledge to the crew. And at the end of the day, and Patty and I were kind of mouthing to each other, this is saving lives. You're saving lives right now, so thank you for that.
Dr. Bulick, thank you. And we will have you on again as you want to talk about the progress, the participation, and then ultimately, obviously, the results. So we'll have you back again.
Absolutely.
Awesome.
And when we kick the training wheels off the mental health moment and give them their own hour,
Oh,
you'll have to kick them off again.
There we go. One more kickoff.
You know where to find me. I'll be here.
Very good.
Thanks,
That's
Cyndi.
Dr. Cynthia Bulick, University of North Carolina. Thank you so much again for joining us. Have a very blessed day, Dr. Bulick.
Thank you.
You too.
Bye.
Take care.
All right. Again, we want to thank Acadia Healthcare for all they have done. We want to thank the Something for Kelly Foundation, the Morgan Foundation. Be prepared. There's going to be a lot of information coming out of JP, Kathy, and the crew and on the network about an event coming up very quickly with the Something for Kelly Foundation. So
Thank you, JP. Yes. Dr. Bulick's going to be involved in that as well.
Will that
November
be
the
another
5th.
get the crew involved?
Get the crew involved.
Get the crew involved.
Yeah.
We're
We
gonna
love
we're
it.
gonna kick off the edgy moment, and we're gonna kick off a lot of announcements.
So, tons of excitement to do and talk about. That's for sure. Patty, again, thank you for the mental health moment and for being here with us.
Y'all, we're
And
so glad. It feels complete. Now, our transfer to the new network, to the new format, to the new studio seems complete now that we have Patty and Steve and our mental health moment and Chris all back as part of our family. We've been really looking forward to getting this back up and running since we made the switch to our own network. And it's like it's never going to be complete unless we have the ability to bring people who are experts to help with the mental health moment. And especially now more than ever.
Right.
We have to talk about this, and I love it that Patty's, and because Patty's so polite and such a lady, and she's like, well, not to be controversial or not. You know what, Patty, you've got our permission. Be controversial, because
Put it out there.
This shouldn't be a controversial thing. This should be everybody should talk about mental health. Everybody should be willing to be as hungry and as rabid as they can to find information. The comment about blood pressure that the doctor made, I'm one of those that I've tried all 3 classes of blood pressure medication. One I'm allergic to, like put me in the hospital allergic to. So that's the thing. She's right. If there were only one blood pressure medication out there, I wouldn't be here. There'd be a large number of people who wouldn't be here. So we've talked about this with diabetes. We've talked about this with cancer. JP's asking for prayers for his dad who had a stroke. We're open about that. Why aren't we open about mental health? And we have to be now more than ever.
Absolutely. And I think Dr. Bulick referenced it earlier in that this whole pandemic that we're processing right now and that we're going through, she observed that we probably have, or definitely have, not probably, an increase in people who are not just experiencing anorexia, but dying from anorexia.
Yes.
We have a colleague who is a regional medical director for a hospital, and she referenced a statistic that the calls to eating disorder centers are up 80%. I mean, that's
unbelievable.
a staggering number.
Yeah.
So if this pandemic can bring about us having a normalized conversation about mental health,
Yes.
about the high risk of eating disorders, there's a whole conversation about the isolation that goes around this pandemic and why that is a trigger for eating disorders, because eating disorders thrive in isolation, and that's a whole subject right there.
Well, and I think any mental health issue thrives in that isolation. And so if you're suffering reach out and get help, especially during the pandemic. I think people who maybe have a little bit of have had trouble with anxiety or disorder or eating disorders, whatever it may be, I think it's even stronger, and we haven't even seen the tip of the iceberg.
We haven't.
That's why we're just so happy that y'all are back on with us. God bless all
I'm
of y'all.
hearing the music. I'm hearing the music.
I thought that was you humming.
No, that's not me humming. You're absolutely welcome, Patty.
Okay.
And before
This is why we need a whole hour.
That's right. Before we go out, I want to make sure we mention the Collin County Conservative Republicans are going to be hosting a debate with Shelley Luther and Drew Springer for the state Senate seat. That is tomorrow night, October 20th at 6:30 p.m. at Redemption Point Church at 107 East Lamar Street, McKinney, Texas. Be there. We'll be there.
We will.
We'll
We're
be hosting
moderating.
it. So
We're
you're
moderating.
welcome to come out and see the debate, or tune into JP, Kathy, and the Crew Network.
Because we will be
We
broadcasting
will be broadcasting
live, permission or not.
Yeah, I'm not asking.
Hey, and a new show starts here in about an hour.
Oh, that's right.
That is the Heart and Soul of Texas Women, a
Yes.
faith-based show that
Super excited.
that will hopefully help, especially during times like this, inspire other women to use their faith and their Christianity to get them from one day to the next, or 1 hour to the next, or 1 minute to the next.
So
sometimes.
spend an hour working and then come back and join us again as we get ready
There
to
you
kick it
go.
off with Lisa
Yay.
Chastain and Kathy Ward.
We're excited.
We're excited. All
Love
right.
y'all.
morning to
Have
be
a blessed day.
Have a blessed day.
Mwah.